And that's what you compare the conditions to what prisoners in solitary confinement experience? It's that bad?
It's that bad. And that's what my mom told me. She said, I'm doing hard time and I didn't even do anything wrong. You know, she makes a joke about it, but yeah.
Bridget, you've been in the medical field for 34 years now. I was also struck by the fact that you're the chair of the Infectious Prevention Division. You are speaking not only from the perspective of a family member impacted, but someone who works in the health industry.
Yes.
What do you want nursing facilities to understand at this point in this pandemic?
I really hope that they understand how important infection prevention is, not just infection control. Infection control is what you do after. It's what you do before that is more than that. It's so much more. And just something as simple as washing your hands in between each patient, not just going into a room, because some of these rooms have 3 or 4 patients in them, but just making sure that basic hygiene is followed.
You and I know, I've done stories, I've been a journalist for 25 years, whether it was Hurricane Katrina, other disasters, a light has been shined at different points on faulty behavior, if that's the way to describe it, in nursing homes, a neglect of nursing home patients. Not all, clearly, not all employees, not all facilities, but there has been a problem that's been swept under the rug, like so many things that are being exposed right now with this virus.
Yes, and I'm really hopeful that people are starting to see because nursing homes aren't what they used to be 30 years ago. Like, for example, the one my mom's in right now, she was there for a knee rehab. She was, you know, on the short-term plan. We expected her to be there a month and then be home with us again. People need to realize that this isn't a place just to, you know, forget about grandma, that kind of thing. These are vibrant people, and 70 and 80 years old is not old anymore.
Bridget, you believe some employees went to work even though they were sick. Why do you believe that?
Because I saw it. We saw people with coughs, cold symptoms, that kind of thing, complaining of how tired they felt. And unfortunately, you know, these are minimum wage workers, and, you know, missing one shift can mean the difference between being able to pay for daycare or pay your rent or not. And it's unfortunate that they just don't have something in place that they feel safe to call in sick. And it's not going to get any better. It's just not until nursing home workers and other low wage workers in the healthcare industry can feel safe in calling in.
What is the prognosis for your mother? When do you think she'll be able to leave?
We think mom will be home within the next couple of weeks. She had her second test and it was negative. So she is doing great. Her attitude is fabulous. And I think that that's the big part of why she's doing so well is, you know, she's keeping the positive attitude. And, you know, having my sister and I there 3 times a day, bringing her home cooked meals. And even though we can't give her a hug or hold her hand, we've been able to sit outside her window and talk on our cell phones and talk to her and just let her know about our day and how the grandkids are, that kind of thing, and just keeping her engaged.
And inside, is there social distancing? How would you be able to verify that?
Well, for instance, they had an employee meeting. It was all staff, and they all showed up and they weren't wearing masks or any kind of PPE, and they were all centered around the social area. And it's not just that I saw it, I took photographs of it because I could not believe it. In the state of Washington, you're not allowed to have a meeting over 10 people. And when I brought it to the attention of an administrator, they said, oh, we're exempt. And I said, no, you're not. She said, well, how do you think we're going to do our job if we can't gather? And I said, look, I work in a hospital. We don't have staff meetings anymore other than by Zoom or a call-in meeting. You're not exempt. And that's the whole truth. They just think that the rules don't apply to them.
Well, we know that you are very, very close with your mother. We want to see you reunited, as we do all of the families, and we wish you the absolute best. Thank you, Bridget.
Thank you. Thank you so much.